Now this is an ultrasound study of an 18 years old young girl, unmarried, with the history. She has been referred to rule out any kidney urinary bladder pathology because she's feeling pain in the right lumbar region for 6 months, and she has been treated by as a case of urinary tract infection, this being her first ultrasound ever. So her kidney and urinary bladder are normal. What we are seeing is uterus measuring, anteverted uterus measuring 7.0 centimeters in length and 3.5 centimeter in anterior posterior diameter. This is the urinary bladder. This area. This is the uterus. This area is the uterus. And this echogenic area that you are seeing is the endometrial canal. This area. It's in the late secretory phase. This is the endometrial canal. So no focal lesion, nothing. Normal by transverse view. Longitudinal view shows no anomaly, no pathology relating to the uterus. Now when I move the probe 90 degrees, I do see a focal lesion, a focal cystic mass in the region of the right adnexal. This is the mass. This area, it measures 4.2 centimeters by 4.5 centimeters, and see that it is echogenic with cystic areas within it. This is a cystic area within it. This is a cystic area, and this is a septa within it. Now why it is cystic is that you see that there is strong back wall, acoustic enhancement, that you can see this brightness behind the posterior wall of this cystic mass. This is the uterus. This is the uterus in transverse section. Okay. This is the uterus in transverse section. This is the endometrial canal in transverse section. This is the endometrial canal transverse section, myometrium, the uterus in transverse section, and this is the cystic mass in the region of the right adnexa with internal cystic areas and a few septas giving acoustic enhancement of strong back wall, so consistent with a cystic mass in the region of the right adnexal. Now, does it change its shape? You see, I have given a sweep to the cystic area almost 180 degrees, and it maintains its shape. The only thing that has come in the view by doing so is that its shape. You see a difference in its shape. Now, this being the thick wall, this is the thick wall of the cystic mass. Thick wall. This is the cystic area. These are the islands of echogenic material. These are echogenic material, islands of echogenic material. Within this is, along with fluid, in which this is the fluid pocket. This is a fluid pocket. This is a fluid pocket, and in the fluid pocket you can see there are multiple humorous tiny echogenic areas, which is the internal echoes or the debris. This area, this. Now this can be, there are two things we can give in differentials. Number one, either it is a tubo-ovarian infective cystic mass in the region of the right adnexa, or it is an endometrioma. So see the strong back wall. This is the brightness that you are seeing posterior to the cystic area. The wall measures approximately 5 5.0 millimeters. So no calcification is seen within it as such. No significant solid element is seen within this cystic area. Now this cystic area is very much consistent with two pathologies that I have mentioned, and the cause of pain. Now this is the endometrial canal. Actually, this is the endometrial canal in late secretory phase. I have magnified the view, and that's the reason that you are getting such a thick endometrial canal, whereas its measurement is 13.3. Then late secretory phase. This is the cyst. This is the uterus. Now this is the urinary bladder. This is the urinary bladder. Okay. This is the uterus. This is the uterus. All of this. Okay. And this is the endometrial canal. Thick echogenic linear area, echogenic canal, and this is the cystic mass with posterior wall acoustic enhancement. Here, when I decrease the magnification, you will get a better view of the cystic area that is seen in the region of the right adnexal, and see the posterior wall acoustic enhancement. See the thickness of the wall of the, this is the wall of the cyst, and this is the acoustic enhancement of strong back wall. This is the hypogastric vessels. These are the hypogastric vessels, landmark of the ovaries. Now you see that the urinary bladder. Okay, the urinary bladder is thin walled, and the lumen is clear of any debris, any calculus, and the kidney बेटा एक लंबा सांस लेके अपने सांस रोकना, जोर से सांस लो. Let me use some jelly. जी बेटा, लंबा सांस रोको, करवट लो. You see that this is the right kidney. बच्चे लंबा सांस रोको. Now you see that this kidney is normal. The minimal, very small amount of hydronephrosis is because of the overfilled urinary bladder, as she had to retain the urine to see the uterus and adnexal. Beta meri taraf. Let's see the left kidney. Let's see it when this minimal hydronephrosis or very small degree of telangiectasia is seen bilaterally. First we must rule out if there is any overfilled urinary bladder or not. Now in this case, because of the urinary bladder, we see some hydronephrosis, dilation of calyces, whereas the kidney is normal. She does not suffer from any other pathology except for the mentioned cystic area in the right region of the right adnexal, the urinary bladder, the uterus, the cystic area. So this is a complicated right adnexal cystic area, consistent with either an endometrioma or infective tubo ovarian mass.